cor pulmonale, otherwise known as cardiopulmonary disease. This is what happens when poor lung function begins to worsen over time and ultimately begins to impact the heart, specifically the right side of the heart and the way that the heart functions. So what once started as one organ system's problem or trouble has now begun to impact the next organ system over, which is the heart. My world. Want to learn more about it? I thought you might. Lock in, let's learn. On today's episode of Make It Make Sense Cardiology Edition, I'm going to walk you through the basics of cor pulmonale. Now, by no stretch of the imagination am I a pulmonary specialist. I am not. Y'all know my world is cardiology. However, when certain disease processes begin to tread over into my county lines, it is incumbent on me, a cardiology provider, to learn about those conditions and how those conditions impact my world, my patient demographic, my plan of care. Before we get into the mechanics of cor pulmonale, it is first vital that you understand the relationship physically of where the lungs and the heart are inside the chest cavity. Now, obviously, the lungs flank the sides of the chest, and then the heart is going to sit towards the middle. There is a series of arteries that connect the heart to the lungs because everything in the body gets blood, right? And the way that everything gets blood is through the arterial network. The arteries that connect the heart to the lungs are called the pulmonary arteries. It's very important that you remember that. Now, there is a main pulmonary artery that comes off of the lower right chamber of the heart. That main pulmonary artery is the pathway of blood flow. Once the lower chambers of the heart squeeze, particularly the right side, the chambers squeeze, they push blood through that pulmonary artery, and then ultimately that pulmonary artery will fork out because it has to go one to the right lung, one to the left lung. All right, makes sense, right? Okay. Now, remember, cor pulmonale starts off as a lung problem. That lung problem can be anything, honestly. It can be, for example, it can be COPD, it can be emphysema, it can be sleep apnea, it can be a blood clot to the lungs, pulmonary fibrosis, interstitial lung disease. You get the point. There's a lung condition that has begun to deteriorate to the point where oxygen exchange in the lungs doesn't happen as optimally as it should. When that impaired oxygen exchange happens, that puts pressure on those pulmonary arteries. Remember that? Those pulmonary arteries then start to become tightened and they become stiffened. And when that tightening and stiffening of the pulmonary arteries happens, guess what? The right side of the heart now has to work that much harder, squeeze that much more forcefully to push blood through those stiffened and tight pulmonary arteries and ultimately to the lungs so that the lungs can do as best as they can. When that increase in workload happens to the right ventricle, that's the lower right chamber of the heart, that right ventricle is going to become thickened over time. It can become stiffened over time. It can become weaker over time, causing it to fail at doing its job optimally. You see how that connects? So when you have patients who are in cor pulmonale, that means that the current clinical condition of the patient exceeds the capacity of what both the lungs and the heart are capable of doing at that moment in time. They need help. They need help. So these patients that present with cor pulmonale are going to present not only with lung concerns, shortness of breath, orthopnea. That means that when they're sitting up, breathing is okay. But if they try to lean back, feel smothered. I can't do that. I can't do that. I got to sit up. That is orthopnea. So these cor pulmonale patients will present with shortness of breath, orthopnea, adventitious lung sounds. That means abnormal lung sounds. You could have wheezing. You could have wet lung sounds because of that underlying pulmonary condition. They're going to have low oxygen saturation. Like there's lung issues going on. There's lung symptoms that are happening In addition to that, you are going to have right heart symptoms also, because remember, it's the right side of the heart that has now become compromised and weak. So you are going to have fluid retention, jugular venous distension. You're going to have swelling in the periphery, the legs, the feet, the ankles. They're going to be swollen. Fluid can't get up to the right side of the heart and ultimately out into continued circulation. You are going to have abdominal distension from the fluid retention in the hepatic portal system. Nurses, you know what I'm talking about. I say all that to say this. There are many different types of right-sided heart failure. This is but one of them. This is but one of them. Not all types of right heart failure will present with this clinical presentation, but this one does. And it's very important to be able to recognize that when you have somebody who presents with cor pulmonale, it is vital that you treat not only the existing heart complication and the fluid volume overload from decompensated right-sided heart failure, but you also treat the underlying pulmonary condition also. Pulmonary hypertension comes with a plethora of treatment options. And again, I am not a pulmonary specialist, so I'm not well versed on all of the medications and treatments for pulmonary hypertension, but I know one very common one that is used in my world of cardiology, and that's the phosphodiesterase inhibitors. You probably know them, lay people and student nurses and even new graduate nurses. You probably know these medications more familiarly by their generic and trade names. Sildenafil, ring a bell? Tadalafil, ring a bell? Sildenafil is the generic name for Viagra, and Tadalafil is the generic name for Cialis. And I know these medications are predominantly marketed for sexual dysfunction, I know, but before they were marketed for that, they were created for pulmonary hypertension. They dilate the pulmonary arteries, or widened those tightened pulmonary arteries that we talked about in the beginning. This is why you can see women on these medications, sildenafil, tadalafil, and a host of others. Again, there's a lot of different other medications that are used to treat pulmonary hypertension, but it is not uncommon to see women on these medications. And if you do come across, as a clinician, you come across a female patient who has these medications in their medication arsenal, please know that they have pulmonary hypertension and not some sort of sexual dysfunction. Just thought I might give you that little nugget of information in case you didn't know it before. I always find fascinating things in cardiology, and it's my pleasure to share them with you. That'll wrap it up today with regard to cor pulmonale, pulmonary hypertension, and that type of right-sided heart failure, because I feel myself geeking out and I want to go into other things like right heart caths and wedge pressures and things like that, and I can't do that right now because it's going to be way too overwhelming. We'll save that for another day. Any questions? You guys know how to get in touch with me. Hit the buttons. See you later.